What's going on, everybody? Today is March 6th, 2020, and this is your SARS Coronavirus 2 COVID-19 update for the day. And we are back. I want to apologize to everyone for not updating in the last month or so. Everything's been crazy with not only work, but monitoring the situation and preparing myself and my family for what is to come. I've seen a lot of things being said. A lot more people are paying attention to this than were a month ago, and I see a lot of misinformation out there. So I figured I would try to educate whoever I could, and if this helps you, then hopefully I've made a positive change. So let's get into it. So it's been a month since our last update, so today I'm going to talk about the changes that have happened in the last month. I have actually prepped my family and stayed current on the situation, so I'm going to talk about some of the preps that we've done. And right now we are on day 8 of self-isolation. So basically we have self-isolated ourselves for 8 days. We do not believe we are sick, but I do not believe there is enough information out there to warrant us going out into public and exposing ourselves potentially to an infection. I also believe that there's a massive cover-up and there's a lot of misinformation in the media, and I'll touch base on that a little bit. I'm not saying that there's a conspiracy going on or anything like that, but I do believe that they're not being completely forthcoming with their information, or they're ignorant. And if they're ignorant, then that's bad news for not only the country but the world. So I will also touch base on how worried am I and how worried you should be. We'll go over some of the facts, and I will go over some of my recommendations and wrap it up with some conclusions. So we'll get started here. So a lot's changed since last month. So since last month, there were 37,135 cases. That was on February 8th. There were 806 deaths. There were 2,623 recoveries, and the mortality rate at the time was sitting at about 24% between the recovered patients and the confirmed cases. Today, as of the time that I put this thing together, there were over 100,000 cases, 100,679. There were 3,412 deaths, and there were 55,991 patients that had recovered, that were confirmed recoveries of the infection. And that brought the mortality rate down to roughly 6% from the people who had either died or recovered. So it has trended down the way that I expected it to. I was thinking it would be between 5 and 10%. I still don't know how accurate this number is. This is taking a lot of account into China. China has probably 80,000 of these cases, and I don't believe their numbers were accurate just because it blew up too quick. They had too many cases. The hospitals had to get overrun, and they locked everybody down. So who knows how many people died in their homes, how many people died in the streets that weren't counted in these cases, or deaths or recoveries. So time will tell what the actual mortality rate is, but people need to start taking it more seriously than they are. This is not the flu. SARS-CoV-2, which is the virus, that's the name of the virus, and it creates the disease COVID-19. So SARS Coronavirus 2 is now in 70 plus countries, and there are over 100,000 cases globally. The USA has seen an exponential increase of infections, and panic buying is increasing throughout the world. So time to prepare is running out, if it's not already too late for you. World economies are starting to tank, stock markets are dropping, world banks are trying to stop the bleeding, and it is not working. I don't think we have seen the bottom of this when it comes down to it. I think it's going to go a lot further. This is something we are witnessing history right now. I think this is going to be an interesting next year, and we'll see how it goes. And I believe that people are finally starting to see this for what it is and start taking it seriously. It's sad that it took a month, 3,000 deaths and over 100,000 cases globally, but there are still a lot of people around the world who aren't looking at this and aren't paying attention, and they're going to find themselves sitting on a toilet with no toilet paper. Right now, I am recommending 6 months worth of supplies instead of 3 months like last month. There have been some things that have changed over the last month that made me doubled down and purchased 6 months worth of supplies for my family instead of the 3 months, because I would prefer to be safe than sorry. So I'll get into that a little bit as well. But those are all the different changes that I've seen over the last month, and there's a lot more, but we'll get into it through time. What I have done, I have prepared my family, and I have stayed current on this situation. So I have taken my own advice from last month. I ended up spending 3 weeks preparing for self-isolation, and we are at that point now. We are currently stocked up on 6 months worth of the following. We have food, non-perishable canned goods and dried goods. We have 6 months worth of food. We have water, 3 months worth of water. And the reason why I chose only 3 months worth of water was, though it was cheap, I believe that the water will still run for a while. I know that there are some places in China that have been reported that they are out of water. I've seen videos of people basically lined up with 5-gallon buckets waiting to get their water, and I don't want to be one of those people. I want to be able to stay in my house as long as possible until this thing blows over. We've also stocked up on medicines. I've gotten Mucinex, and it's the blue box, the one that has nothing else in it except for the gustafacin or whatever it's called, the stuff that thins out the mucus, the expectorant. I did not get the stuff that has the cough suppressant, because when it comes down to it, your coughing is your way of clearing out your lungs. So with the amount of mucus that this thing creates inside your lungs, you don't really want to suppress the cough. It'll make it worse. We have Tylenol for lowering fevers and headaches and things of that nature, hydrogen peroxide. We also have 91% isopropyl alcohol, bleach, cleaning supplies, sanitation supplies. We do have N95 face masks, a few, and I have 2 P100 respirators for my wife and I. None of the masks fit on our children, which is a problem, but I'll figure out something. I'm more worried about us being exposed, but at the same time, if they get exposed, then they'll expose us, and that's not a good thing. We are also trying to be on top of it with supplementation. I am trying to boost our immune system so we can basically prevent infection instead of treating. An ounce of prevention is worth a pound of cure. So we are right now loading on vitamin D3, vitamin C, zinc, selenium, and antioxidants, basically a basic antioxidant powder. We also have enough toilet paper to last us 6 months, I hope. And we also purchased some books, art supplies, board games, things of that nature. So those are the things that we have prioritized when we are looking at the stocking up and preparing. And we have finished doing that about a week ago, and now we are trying to minimize our exposure to the public. We are currently on day 8 of self-isolation, and there's a reason why we self-isolated ourselves. I firmly believe that this is all over the place. The incubation period is anywhere from 2 to 24 days, and it has asymptomatic transmission, asymptomatic spread. So if anybody were to, I could run into anybody, and I meet a lot of people. We could run into anybody. They look perfectly healthy, perfectly fine. They could give me something that I could take back and give to my whole family, and I wouldn't even know it until we were sick, and then they got sick, and it's not something I want to put myself into. So basically what happened with us is we discovered that one of our daughter's classmates had recently traveled from Italy, and this was right when it started popping off on February 26th. So what we did is we pulled both of our children out of school for 2 weeks to assess the global crisis, the growing global crisis. The way that we looked at it, and we spoke to the school district, and they provided us the schoolwork for both of the children. We figured that it's better to be safe than sorry. These individuals came over from Italy. They were there for a week, and there had already been numerous travel associated cases. We didn't feel comfortable with her being in that room, and we're not necessarily worried about our daughter. We're more worried about us. And the way that I feel is that schools are notorious as petri dishes. And if one of these kids gets sick and gives it to our kids, I'm not necessarily afraid of our kids. falling ill, but I'm afraid of them giving them the illness to us, or any parents for that matter. The way that I look at this is that if a kid brings it home and gives it to their parents, what happens if both of their parents pass away and now you got an orphan kid? Can't take care of themselves. I'm not going to allow that. I don't want our kids to be put into that position. So that's why we decided to do that then. And we have not left the house, but to go for walks in empty parks or down the road during a time when most people are at work and nobody's really around. Though this morning I did go to the store. I was fully dressed in my personal protective equipment, and I went there for a small amount of perishable food. It's most likely my last trip to the store for the foreseeable future, and there are a couple different reasons why I did that. First, my wife wanted a couple things, and I wanted to basically do a trial run for my personal protective equipment. I wanted to put it on, I wanted to walk around, I wanted to see how that went. That way I had a little bit of experience. So when I say personal protective equipment, I'm talking earplugs, goggles, airtight goggles, P100 respirator mask. Those were the three things that I wore on my head, and then I had regular examination gloves that I wore into the grocery store. And I'll tell you, the people who worked there looked at me like I had three heads, but I would prefer to be safe than sorry, especially with this thing. There a lot of things indicate that this could be airborne, and I don't want to walk into somebody's breath who was there 3 hours ago that has it, and I don't want to get it because of that. So right now we are working from home, and we're utilizing phone calls and video conferencing. Right now I believe that there's a massive quote-unquote cover-up, and there's a lot of misinformation in the media, and it's one of two things. It's either on purpose, or it's just they don't know what they're talking about, and they don't know what they're doing. This outbreak has taken longer to grow than I expected. I figured that there were cases floating around, and there has been cases floating around in the United States for the last month plus, but I was waiting for people to become positive. One of the things that I did not expect is I expected the government to be transparent and report cases when they developed. What I didn't expect was them not to test anybody. I believe that it's a cover-up. One of two things. I believe it's a cover-up to allow the government to buy more time to prepare, or there's just too many chiefs, not enough Indians. They're ignorant and naive, and if that's the case, then we're all screwed. But why do I say it's a possible cover-up? Well, because the USA hasn't been testing patients. If they don't test, there are no confirmed cases. If there are no confirmed cases, then people aren't going to panic, right? So let's think about it. About a month ago, they enacted the travel bans in China, and for about 3 weeks, we had 11 cases. Now here we are, 3-4 weeks later, and everything is starting to pop up. And all of these people are getting sick, and all of these people are finally getting tested. Now they're blaming this on a lack of test kits. I mean, South Korea has tested probably by now over 100,000 people. Up till last week, we had only tested less than 500. So there's a serious error there, right? They're blaming it on a lack of test kits. But in reality, it was the incredibly strict testing requirements which prevented testing in the United States. People had to have traveled from China, specifically the Wuhan area, in the past 14 days, or they had to come in contact with a confirmed patient, and there were only 11 in the US at that time. So if there's only 11, how do you know you came in contact with one of those people? They won't even tell you who they are. And you had to show symptoms in order to be tested for that. So the criteria was so strict, people are going to the hospitals wanting to get tested, thinking that they have this thing, and the doctors are saying that they're not doing it. They can't do it. They don't qualify. There's doctors calling the CDC, begging them to be able to test it, and the CDC saying no because they don't fit the criteria. So if they don't test, then there's no cases, and if there are no cases, then people aren't going to panic. It's possibly a control mechanism for them to be able to get all their pieces in place. That way, that once everything does blow up in here, they have the most amount of control possible. And that's just it. It allowed the government to state it wasn't an issue in the United States and keep people calm. Now, scientists are studying the outbreak in Washington state, and they believe it's been circulating in that area for over 6 weeks. 6 weeks it's been circulating. So if it's been circulating everywhere for 6 weeks, then it's everywhere, literally everywhere. I mean, it could be in every city in every state with the amount of globalized travel that we have right now. Anybody could have it, which is, again, one of the reasons why we chose to isolate ourselves at this point in time. So how worried am I? Very. How worried should you be? That's completely up to you. I've told few people about this, mostly just very close friends, relatives that aren't local. I haven't really told anybody locally except my wife and her mom. But as of right now, I am still pretty worried about it. And she's getting a little aggravated and annoyed at the fact that I'm researching this stuff as much as I am, and that it's on my mind, but it's really, in my view, it could be potentially a matter of life and death. So as from the beginning, I'm very worried about this virus. When I first saw it, it was January, there was 41 cases. And I kind of popped in my head and I said, man, that's really, really scary. I need to keep an eye on it. And it was not only the spread, but the deaths associated. And really, what scares me is the socioeconomic ramifications. I think that they're going to be much worse than the virus itself. The goal should not to be worried about or afraid. We need to be aware of the seriousness as well as be prepared for the worst case scenario. Fear is a very powerful emotion. When people act off emotion, they naturally act illogically. You need to be open to logical thinking and understand that this may have a drastic impact on your life over the next 1 to 3 years. I mean, it could be 6 months to 3 years, but you really should plan for this to have a long-term effect on your way of life and your overall day-to-day way of life. The good news is that this is going to impact everyone equally. So you really don't have to worry about the repercussions of not being able to pay your bills. If nobody pays their bills, then nobody cares that nobody paid their bills. We're all in the same boat here. Money is temporary. Your health and welfare, that's priceless. That's really what you should be concentrating on. Not if you paid your car note. Because I'll tell you what, if nobody's working and everybody's isolated and there's a lockdown quarantine, there's nobody coming to take your car. And everybody else didn't pay their bill either. So really, you need to prioritize this stuff, prepare for it, get stocked up on some food and some water and some supplies. That way, if you are forced into lockdown or you choose to lock down, you don't have to go out into public and potentially expose yourself. What are the facts of this virus? So it's highly contagious. It's so contagious that it worries me. It's much more contagious than influenza. It's much more contagious than really anything that we've seen sans measles. But who knows? This thing could be as contagious as measles, if not more contagious. It's a respiratory illness. There is no effective treatment or cure to date. It affects the elderly and those with underlying health conditions, which really does concern me in the United States and even the world. But it's more drastically affecting the elderly and people with underlying health conditions than those who are young and healthy. But examples of people with underlying health conditions is heart disease, obesity, diabetes, cancer, lung issues like chronic smoking. All of these things put you at increased risk of becoming a critical or serious patient, getting that pneumonia, and basically, your body's shutting down, and organ failure, death. This is not a nice disease, and that's very, very nasty. And all of these things are going to put you at increased risk. And here's the problem. In the United States, there's a lot of people with heart disease, obesity, diabetes, cancer, lung issues that aren't elderly. They're not elderly, they're not old, they're young. But these are going to increase their risk. So people who think that they're young and healthy are really not young and healthy. And they're not paying attention to this, and they should be. One of my biggest concerns is that it spreads asymptomatically. This thing You can't tell if somebody has it or not, and they could give it to you. And the incubation period is also super scary. It's anywhere from 2 to 24 days. They say 2 to 14, but there's been several studies that have shown it could be upwards of even 27 or 28-day incubation period while being contagious. So right now, there's really not enough information to risk exposure to the public at this point in time, for myself at least. So what are my recommendations? I think everyone, I think that you should stock up on supplies to last you and your family for 3 to 6 months. Figure out how many calories you need and buy enough food to last you 3 to 6 months. I recommend 6 months. Once you're all stocked up, that should be pull. So pull children from school temporarily to let this play out for a little while and allow more information to be discovered. Why? Well, like I said, though children may not be adversely affected as adults, children can turn into carriers who will, in turn, infect their parents. I'm more worried about parents dying and leaving their children as orphans than the children dying of the illness. And also monitor the news. But don't read news articles. Read the press releases. News articles, they're less news, they're more about opinions. I try to make my decisions based on facts, not on other people's opinions. Those who base their decisions on others' opinions are most at risk. Perfect example, masks are more likely to get you sick than not. I've been seeing this all over the place. It's not true. What they do is they take a little bit of it and then they kind of change it. They concentrate on one specific thing and then try to rationalize it as the truth when it's not. And 95 masks, P100 respirator masks, are effective at preventing this virus from entering your respiratory system. If worn properly, if used correctly, they can decrease the chance of infection, period. That's why doctors are using them, and that's why the government is wanting to buy them. They got 40,000 of them. If they didn't work, they wouldn't buy them, they wouldn't waste their money on them, all right? So do your own research, don't listen to the hype. News articles always cite their sources online with hyperlinks in the articles. I get my news from the press releases themselves and scientific studies. It's a little bit more work, but it's more accurate and it can give you what you need to make a logical decision. My conclusions? Well, I plan on doing these a little more regularly, answering whatever questions people have. I see many people awakening to the seriousness of this pandemic, and I want them to have another place that they can go where they can get accurate information and ideas. But I don't want people to base their decisions specifically off of my opinion and my analysis of the situation. Everybody should do their own research. If you want me to cover a specific topic about this, let me know and I'll cover it. Just let me know in the links below or the comments below. You really need to prepare yourself for the possibility of social distancing. The CDC is already leaving hints on that possibility and told the public to prepare for a pandemic weeks ago. So if you're not preparing, the government already told you to. So that means it's already too late. You should really take it seriously and create some plans for you and your family. And you don't want to wait. You don't want to wait to protect yourself and your family. You need to stay aware, keep up to date, and use your own logical thinking. Though I hope it never happens, your survival may eventually depend on it. So I hope this helped. This is your coronavirus update for the day. Take it easy.